An overview of lupus disease: causes, symptoms and treatment. Lupus is an autoimmune disorder that affects millions of people worldwide. It is a complex and long-term condition that can have a significant impact on a person's life, affecting their physical and mental health. While it can be a challenging condition to manage, early diagnosis and treatment can help to improve the quality of life for those living with lupus. In this article, we'll explore the causes, symptoms and treatments for lupus. We'll also discuss the challenges associated with living with lupus, as well as the importance of finding support and living a healthy lifestyle. With the right information, it is possible to manage lupus and lead a full and active life. What is lupus? Lupus is a complex autoimmune disorder that affects millions of people worldwide. It's a diverse condition that can affect people in different ways. There are many different types of lupus, and the symptoms, severity and course of the condition will vary from person to person. Lupus can affect people of any ethnicity or socio-economic group, and is often associated with a certain age group. While it can affect anyone, it's more common in women in their 20s, 30s and 40s. Lupus affects different parts of the body in different ways. In some cases, the skin may be affected, while in other cases, the eyes, joints or kidneys are affected. In many cases, the signs and symptoms of lupus don't appear until years after a person has been exposed to the trigger that set the condition off. People with lupus often experience a wide range of symptoms, including causes of lupus. The exact cause of lupus remains unknown, but research has suggested that it may be linked to an infection in the womb, known as pregnancy-related lupus. It is possible that an immune response to the infection could result in a condition that develops later in life. In addition to being linked to an infection during pregnancy, lupus may also be caused by certain genetic factors, environmental factors and certain medications. It is also associated with certain diseases, including endocrine and blood disorders, as well as other autoimmune diseases. Lupus can affect anyone, but some groups are at greater risk, including African Americans, Latinos, American Indians and people who have a family history of lupus. Symptoms of lupus. Symptoms of lupus vary from person to person, and may include hand, foot, neck cataracts. Cataracts are clouding of the lens of the eye. A cataract is a clouding of the lens in the eye. It causes blurry vision and can make it difficult to drive or read. Many people with lupus have cataracts in one or both eyes. It's often a progressive condition that gets worse, not better. Skin changes. Skin changes are common symptoms of lupus. The skin on the hands and feet may be blue and swollen, erythema, or red and swollen, erythroderma. The face and scalp may be swollen, erythroscalpebral, or erythrodermitis, or have dark patches, necroscroff. The eyes may be bloodshot or have a yellow, white, sclera, or red ring around the iris, scleral, or sclero, or scleral, or iris changes. The mouth, gingivostomatitis, or genitals, perineal, or genital, may be swollen or painful. Swollen joints. Swelling in the joints can make it difficult to move, sleep or exercise. Swelling in the ankles, wrists and hands, edema, or in the hips and spine, spondylitis, may make it difficult to lie down comfortably or move around. Pain in the joints is common, especially when movements increase the inflammation. Stiffness. Stiffness is common, but people with lupus often have a stiff neck, cervicosternalgia, or feel like they have a heavy load on their legs when they stand up, cascara. Skin picking. Some people with lupus have urges to pick at their skin. This may be out of control, and cause scars, keloid. Mouth sores. Sores on the lips, leukoplakia, or inside the mouth, gingivostomatitis or gingival, or on the tongue, glossodynia, may be painful and may need to be treated with medicine. Diagnosis of lupus. A diagnosis of lupus is usually made after a person has been evaluated by a doctor who is familiar with the signs and symptoms of lupus. An accurate diagnosis is essential for planning treatment, and for ensuring the person's safety. The doctor will ask about the person's symptoms and medical history, as well as perform a physical examination. They may also ask the person to take a blood test, particularly if they have no other symptoms. The doctor may also order other tests if they think they are relevant to the diagnosis. Some tests may include blood tests, erythrocyte sedimentation rate, blood pressure, complete blood count, thyroid tests, blood sugar levels, kidney function tests, lupus antigen tests, C-reactive protein levels, ANA titer. Imaging, bone scan, brain MRI, CT scan, lupus eye scan. Biochemistry, thyroid function tests, lupus antibody tests, complete blood count, kidney function tests. Other tests, urine tests, stool samples, sleep studies, hormonal testing, genetic tests, nerve conduction studies. Treatments for lupus. There is no one cure for lupus. Treatment aims to reduce the severity and frequency of the symptoms, improve the overall health and make the daily life easier. Treatment for lupus may include medications to control the symptoms, medications to prevent flare-ups and treatment for coexisting disorders. Treatment for lupus is often complicated and may include medications to manage symptoms, as well as treatments for other diseases that may be contributing to the signs and symptoms. Medications used to treat lupus can include antimalarials. These medications are used to control the symptoms of lupus. The most commonly used antimalarials are hydroxychloroquine, Plaquenil, chloroquine, Aralen, hydroxychloroquine, Plaquenil, and chloroquine, Aralen. Hydroxychloroquine is the drug most commonly used in lupus. Immunosuppressants. These medications are used to stop the immune system from attacking healthy cells, and to prevent flare-ups of lupus. Immunomodulators. These medications may reduce the symptoms of lupus and help the person feel better. Lupus eye disease. Retinal lupus erythematosus, RLE. This condition occurs when the eyes are affected by lupus, and can result in vision loss, blindness and pain. A drug called tacrolimus is used to prevent the immune system from attacking healthy cells, and to treat RLE. Challenges of living with lupus. The daily challenges of living with lupus can vary greatly from person to person. Some people may experience a reduced quality of life due to the impact of the condition, while others may be able to lead a full and active life. Understanding what to expect and managing the challenges of living with lupus can help to improve the quality of life for everyone. Lupus is a chronic condition that can affect people of any age, and the challenges that arise will vary from person to person. Some challenges may be related to the symptoms of the condition, while others may be related to other health issues. It can be helpful to talk to others who have lupus, as well as to someone who is knowledgeable in the area of disability management. What you need to know about human